we'll pick up where we left off. We were talking about the uterine artery and the course of it over the ureter. So in women, you have this uterine artery obviously supplying the uterus. That's going to get larger during pregnancy, and it's going to course over the ureter. And we said that that was important because if you're doing a hysterectomy and you're taking out the blood supply to the uterus, you don't want to nick the wrong thing. So the uterine artery is always going to go over the ureter. The analogous structure to the uterine artery in the males that's going to have that same relationship with the ureter is going to be the spermatic cord or the vas deferens. All right, it's going to travel up over the ureter and down into the prostate gland. So that's going to have the same. You're going to have the same analogy there. Water goes under the bridge, so the ureter is always below. Okay, and blockage in that uterine artery is going to have the collateral circulation from the vaginal and ovarian arteries. And those vaginal and ovarian arteries come from the abdominal aorta at L2 and travel in the suspensory ligament of the ovary. I'm sorry, not the vaginal and the ovarian. Just the ovarian arteries come off from the abdominal aorta at L2 and travels in the suspensory ligament of the ovary. Of course, in the males, you're not going to have ovarian arteries. You're going to have the testicular arteries. And we know the importance of the testicular arteries and the veins that go along with them. The left testicular vein is going to feed into the renal vein, the left renal vein, whereas the right is going to go directly into the inferior vena cava. So that's why the left testicle always hangs a little lower, because it's not, I guess, held as tautly into the venous exchange. And also, if you have any varicocele, which is just congestion of the veins, which forms like the spaghetti structure in the testicles, it's more common on the left side because it is coming off a renal artery than going in directly into the IVC. If you're finding a varicocele on the right side, it means that you have a huge block somewhere because it's not draining into the inferior vena cava and it's becoming congestion. All right, back to arteries. We talked about the uterine artery, we talked about the middle rectal, internal pudendal, and the inferior gluteal. Next, we'll talk about inferior vesical artery, also called kind of the vaginal artery at the same time. So vesicle, when you hear the word vesicle or vesicular, you want to think bladder. Okay, vesicle is going to be the bladder. So this is going to supply the vagina and the bladder in the women. And in the men, it's going to supply the seminiferous vesicles, the prostate, and the bladder. Okay. The next branch off the anterior trunk is going to be the obturator artery. We should be very familiar with this by now. It goes through the obturator canal with the vein and the nerve, and it supplies the medial compartment of the leg. Cool. The umbilical artery is going to be the last branch off the anterior trunk. And the umbilical artery turns into the medial umbilical ligament. In the fetus, that's what's going to be bringing blood to them. But the umbilical artery in men becomes a superior vesical artery. So we said vesicle is bladder. The superior vesicle is just going to be the top of the bladder. It supplies the bladder. You should know that it's a branch off of the umbilical artery. All right? So umbilical artery turns into the medial umbilical ligament and gives off superior vesical artery. Let's see what else. I think that covers the arteries for the pelvis and the perineum. If I think of anything else, I will for sure mention it. Okay. So let's move on to the sacral plexus. This is a big plexus to know, and the nerves are going to be important to know. The book kind of does a poor job of mentioning the organization, where things go to, so let's just lay it out. And a lot of it will be reminders from lower limb. You should kind of already know, so that'll be easier. And the biggest one that we're going to focus on in the sacral plexus is going to be the pudendal nerve, because that's going to supply a lot of the external genitalia. Okay, so let's go ahead and start. We will start with the sciatic nerve, which is the largest nerve in the body, and it's from L4 to S3. And of course, it gives off the tibial and the common fibular branches. The tibial is going to be L4 to S3, and the common fibular is L4 to S2. We talked about in lower limb, it's going to be the posterior motor of the thigh and the leg, and the sole of the foot. Common fibular is going to be motor to the lateral and anterior, and sensory to the anterior and dorsum of the foot. Cool. The next branch is the inferior gluteal nerve, L5 to S2, and it is motor to the gluteus maximus. Superior gluteal nerve is L4 to S1, and it's going to be motor to the gluteus medius and minimus and the tensor fasciae latae, superior to the piriformis. So remember, we talked about the superior gluteal artery superior to the piriformis, and superior gluteal nerve will go along with it. We have the pudendal nerve coming off of that. Just another nerve coming off the sacral plexus. That's going to be S2 through S4. So S2 through S4 keeps the penis off the floor. Okay, that's how you're going to remember that pudendal, which is going to supply all those innervation and stuff to the perineal structures, parasympathetic, sympathetic, whatever. That's all going to be through pudendal nerve S2 to S4. Nice. And we'll come back to talk about that because that gives off branches as well. The next nerve is the nerve to the obturator internus, L5 to S2. Supplies the obturator internus and superior gemellus. The next nerve is the nerve to the quadratus femoris, L5 to S1. Quadratus femoris and inferior gemellus are supplied by it. You have the posterior cutaneous nerve of the thigh, S1, S3, and that obviously does what the name says it is. Perforating cutaneous, S2 to S3 is the gluteal fold, and that should be known just as a dermatome. Usually it's like S3 right there at the gluteal fold. Then you have the nerve to the piriformis, which is S1 and S2. And the last nerve in that plexus is the nerve to the levator ani, coccygeus, and the external anal sphincter, which is S4. So sensory between the anus and the coccyx. Yes. Let's go back to the pudendal nerve then. The pudendal nerve is a somatic nerve, so it's going to innervate a bunch of things, all right? We'll start with the first branch. It's going to give the dorsal nerve to the penis and the clitoris, and those run between the two layers of the suspensory ligament of the penis and the clitoris, all right? The dorsal nerve to the penis and the clitoris. Something to remember just when you're thinking about the penis and the anatomy of it is that the penis's anatomical position, think of somebody lying flat on their back, and what you think is the bottom side of the penis is going to be laying up, right? The erect penis is anatomical position, okay? Erect penis is anatomical position. So the top of the penis is the dorsal side, and the bottom is the ventral side. So when we say the dorsal nerve to the penis or the clitoris, obviously in this case the penis, we're talking about the top, what you see if you're looking straight down if you're a male, all right? Don't confuse that. I'm going to stop the video there just because we're approaching the 10-minute mark, and we'll pick up the nerves again